All right. Chapter 12, Spirituality. So, if you've heard me say anything in these recordings, it's usually the holistic care, H, not WH. So, the whole person. So, we know that some people are spiritual, some people are not. Some people have different levels of spirituality than we do, and we just need to be open minded to each. So typically, what we ask when someone is sick is there someone that we can call from you from your faith community? Faith community keeps it very non denominational. So they will tell you yes or no, right? So you always want to ask their permission, not call someone. You would always want to ask their permission before you have somebody show up. That could really turn someone off. Especially in my past of being at a Catholic hospital, we had to be very careful about that we didn't just call a priest for someone. That could be looked upon very differently in different cultures and different spiritual worlds. So just being aware that everyone has different practices. Again, the disclosure statement. I do not own this material under fair use. I am providing lecture content for only my nursing students using this material, and all content within is for educational purposes for nursing students and does not provide medical advice. So, there are different histories of spirituality in nursing. There's pre Christian, early Christian, post Reformation, and mid 20th century religions. What is religion? So religion, typically people think Methodist, Catholic, whatever, right? But it's technically not that because Native Americans have religion as well. But they're a set of beliefs, practices, and codes of conduct associated with a structure, typically a church, a mosque, a synagogue, or organized group that integrates beliefs and values into a way of living. There is typically a map to get to a certain location, and religion tells you what to believe and what values are essential. So many of the world's religions hold common beliefs and are labeled Christian. Christian may mean several different things. Okay, so Baptist may be Christian, Catholic may consider themselves Christians. There are many Christians in the world. There may be different religions within that. Okay, so whenever we mention it, we might say spirituality instead of religion because religion might be frowned upon by someone, where spirituality is different. So spirituality could mean dream catchers, herbs, practices, a larger being may be in there or not. Okay. So we usually don't say, what God do you pray to? Something like that, because you don't, that's making an assumption. Okay. So being open, spirituality is a journey that takes place over time and involves with accumulation of life experiences and understanding. And it's an attempt to find meaning, value, and purpose in life. That's typically why people are spiritual or less spiritual. So, clicker check. The nurse notes on admission form that the client has indicated no religious preference. What does this indicate to the nurse about the client? Does not follow the tenets of a specific faith, is in denial about their religious beliefs, does not believe in God or a higher power, or will not want to pray or visit with the chaplain. What does no religious preference mean? No religious preference may mean that they have not got a certain religion that they prescribe to. They do not follow the tenets of a specific faith. Okay, so you can't call the Catholic priest, right? You can't call a Buddhist monk because they don't follow the tenets of one specific faith. They may have a different spirituality preference, which is a blend of many different ones. Okay, so even though the client may not follow the customs ascribed to a certain religion, there's no data to suggest that the client does not believe in God or would not want to pray with a chaplain. So the core issues of spirituality is faith, hope, and love. And if you know the typical biblical passage on that, faith, hope, and love of which is the greatest. Right? That's a typical quote. It's a very famous quote. So, in that, think about nursing as being spiritual as well. We have faith, we show patience, hope, and it's our caring that shows our love for another individual. Cures, miracles, and spiritual healing. So there are parts of spirituality that some people think that a miracle is anything that allows for the presence of the transcendent. So a miracle does not necessarily involve cure, but maybe the relief of symptoms or disease. Miracles commonly proceed according to natural law, and miracles can have a profound impact on a person's expectancies. Some research suggests religion has a positive influence over physical and mental health, and research does not always answer why or how religion affects health. Major religions, we did do some of these in HCR 230, but just so that you know, Judaism, there's Orthodox, Conservative, Reform, Reconstructionist. So there are different types of Judaism. There's different types of Christianity. It could be a Roman Catholic, Jehovah's Witness, Mormon, Seventh-day Adventist, and some of these are in our local area. Could be Christian Science, but it's lumped under Christianity. There's also Islam, Hindu, Buddhism, Native American, atheism. There's several religions, and the best way to understand any of them, just like any culture, is to ask the person, what do they believe? What do they want you to do? Always make no assumptions. It would be most important for the nurse to instruct the UAP to assist clients of which faith to wash their hands before meals. So who would want to do that? So that is a cleanliness is an important value in the Islamic faith. Muslims may engage in ritualistic washing of the hands, face, and prefer free-flowing water. So that is good to know. Again, you would ask, right? What every nurse should know. Gain self-knowledge. Be open. Welcome challenges. And take time to reflect. Spiritual care demands non-judgmental attitudes and open thinking. If you're aware of any biases, it'll be easier to avoid abuses of spiritual care. Always ask. A lack of awareness of spirituality in general, the lack of awareness of your own spiritual belief system, and differences in spirituality between nurse and client may be barriers to spiritual care. If somebody is not spiritual, they may not even think to ask, do you want a person of a religious order to be here? Some people may not even understand that there are last rites, blessing of hands, things like that, until they find out about that from the patient. Okay. Fear honestly is your knowledge base is insufficient, and fear is where spiritual discussions might lead. We really are fearful about praying with patients or saying anything because they may ask us to pray for them. It's okay to defer to pastoral care or spiritual care at a hospital. So some of the tools available are Hope, Gerald Spirituality Wellbeing Scale, the Spirit Model, and different levels of spiritual assessment as well. So I know the Hope model is mentioned as well in your book. Spiritual assessment. So just to look that up really quick. It's a practical tool of spiritual assessment. And the hope questions, when you look it up, the H is sources of hope, strength, comfort, meaning, peace, love, and connection. O is the role of organized religions for the patient. P is personal spirituality and practices. And E is the effects on medical care and end-of-life decisions. So using the hope questions will provide a formatted tool to be able to assess the patient in that process. Up to 77% of patients would like spiritual issues considered as a part of their care. Only 10 to 20% of physicians actually discuss these issues with their patients. So it kind of falls on nursing to be able to have those relationships, have those conversations, and get the person provided to the right resources. So always ask, like, what's your source of hope, meaning, purpose, those kind of things will help you lead to that conversation without saying the words religion or spirituality. Sources of information on spirituality. You can always pick up things from their environment, their questions, their behaviors, moods, feelings, and nonverbal communications. So if you see religious articles in the room, if you see pins with medals on them, if you see religious articles, crosses, things like that may bring it to your attention. Okay, you can certainly question, ask them. You can talk about nonverbal communication as well. If you see them praying, you'll know. Okay. So impaired religiosity is a nursing diagnosis related to spirituality. Risk for spiritual distress. Okay. So these are some nursing diagnoses. May need a referral, spiritual interventions used to treat and prevent spiritual problems related to a client's illness. So again, a Catholic typically wants last rites or blessing in the hands or a prayer before they go into surgery, a blessing of the sick. Last rites are usually meant for final passing into heaven. So just think to yourself, you're assigned a 17-year-old client who lost her right leg in a motor vehicle accident. After her parents leave, she asks you, why did God let this happen to me? I've always followed his commandments. So what is your nursing diagnosis and what evidence supports your diagnosis? What would you do? So she has spirituality. She might be in spiritual distress at this point because she's questioning why God did that to her. Okay. What's the next step in providing spiritual support for her? If you are not familiar with her religion or wanting to have spiritual conversations, you can always ask her, would you like me to call someone? Why is it appropriate or not appropriate to answer her question? It could be inappropriate if it's going to put your answer in a negative light. You don't want to have that conversation. You don't want to answer that. She's asking the universe that question and not specifically you, right? Your patient lost her right leg in her motor vehicle accident. Her parents leave. She asks, why did that happen? I'm following. Which action best depicts the caring aspect? Let me call your parents back to support you. I think the chaplain can Provide support that you need. Cry with the client as you hug her, and hold her hand, sit with her, and listen. What would be the caring aspect? You don't always have to have an answer. Passing the buck is never going to be the answer. If you pass it on to someone else, that may not be the full answer, right? What is she asking you for right now? I don't necessarily think that she's asking you to cry with her because that makes her more depressed, right? But in the fact that you hold her hand, you sit with her and just listen and be that caring, supportive person, that caring connection can be made. Okay. She just needs time to express her feelings and go through the grief process. You are the person chosen to do that. You need to be non-judgmental in that. You need to be present. Just sit with her and engage in active listening. There's no right words. It's okay. Sometimes we don't have answers. So prayer, determine if the patient wishes you to pray for them or with them. Never tell someone that. Always ask, because they may not believe in prayer. Ask what the client would like you to address in prayer, if they do. Don't make the determination for them. So, how the client prefers to address the divine. Ask the client if any ritual or religious items are needed before prayer. And always always feel free to pray and not to pray with a patient. It's up to you. It's your choice. So if they need religious items or rituals carried out, you can always ask spiritual care for those, potentially the volunteer office as well. So I know a lot of patients like to have their rosary with them, especially if they're going into the MRI. Now, knowing the MRI is a metal-safe environment and you can't have metal in there, many rosaries, a string of beads, are held together with metal. There are typically family members, volunteers, or community groups that make cord ones that are metal safe so that they can use the prayer beads while they're in the MRI. MRI is a closed tube and it's very anxiety provoking. So that might be a typical request that you get. Do not be compulsive about praying or avoiding prayer. Be open to the experience. Know that there are appropriate times and places for prayer. When a client asks for prayer, know how to reply. Focus the prayer around the client's request. Know that prayers are realistic. If composing a prayer is difficult, use existing prayer from religious texts. Include the request for the divine to help involving the healthcare team, and thank the client for being asked to participate in prayer. Would this statement by the nurse be correct? We should pray to God so that your cancer goes into remission. Is that a correct statement? So a nurse should not be stating the intent of the prayer session. The client should do that. Several religions were discussed under the major religion section in the textbook. Which impact will the diversity in religions have on our nursing practice? The biggest thing to think about is asking the patient first. Don't make assumptions. Assess your own spiritual well-being, and how will you assess spiritual well-being in your clients with a formal assessment tool? How do we assess religion? Okay. Talk to you later.